Ooh, ah.
Hello everybody, it's Ryan Liberty, and thank you for joining me once again in this series on trauma, Everything That You Need to Know. Welcome back. In this section, we're going to focus on people who are at risk for trauma symptoms but often go overlooked. Those people are people who are in the helping professions. So the helping professions are things like social work, therapy, medical professionals, anybody who's basically in an ongoing empathic relationship with somebody who is vulnerable or suffering, like people who've been through trauma. That group of people is more likely to go through traumatic symptoms as a result of working with people who've been through trauma, interestingly. So when we're looking at the way that this presents, we have 4 different ways of describing what happens to people who have worked with people who've been through trauma. And the ways that we describe this include vicarious traumatization, secondary traumatization, burnout, and compassion fatigue. Vicarious traumatization. Vicarious traumatization involves changes in somebody's thinking when they've been working with somebody who's been through trauma. The changes that we see in somebody's thinking through vicarious traumatization include negative thoughts about oneself, negative thoughts about the world in areas like safety, trust, and control, and changes in spiritual beliefs. Secondary traumatization. Secondary traumatization results from having that empathic relationship with somebody who's been through trauma. And what we call secondary traumatization is really just a mirroring of the symptoms of trauma that we normally would see in anybody who's been through trauma. So any of the symptoms that we've talked about in the previous section could show up in secondary traumatization. Something important to note is that if these were present in enough quantities to meet the full diagnosis of a trauma and stressor-related disorder, we would just use that disorder as the name and we would not call what's happening secondary traumatization. Burnout. Burnout is a result of chronic exposures to people who are vulnerable and people who have been suffering, as is the case with people who've been through trauma. Burnout is physical, emotional, psychological, and spiritual exhaustion. And unlike vicarious traumatization or secondary traumatization, where we typically see symptoms present almost immediately after exposure, burnout is something that happens progressively over time. There are 3 things that define burnout, and those are emotional exhaustion, depersonalization, where we start to lose that sense of ourselves, and a reduced sense of personal accomplishment, which can be a result of working with people who've been through trauma and trying to help and seeing that they are not getting much better after your help is provided. Compassion fatigue. Compassion fatigue is just a label for the combination of secondary traumatization and burnout occurring at the same time. In other words, you see symptoms of trauma like you would see in secondary traumatization, but you also have the exhaustion, the depersonalization, and the sense that our accomplishments are not adding up to very much that you would see in burnout. Put the 2 together and you get compassion fatigue. Risk factors. There are a number of different factors that will increase your risk of going through any of the phenomena that we've talked about so far. These risk factors include working in a helping profession, in particular having a high caseload of clients, working for a company that doesn't recognize anything that we've talked about so far as valid phenomenon, having a chronic use of empathy in your workplace, feeling a need to repress your feelings and emotions as a result of working with traumatized individuals, having a pre-existing anxiety disorder, mood disorder, or pre-existing trauma history, having little influence over the policies that are in place in your workplace, having conflict among you and your coworkers, having a low amount of peer support, having maladaptive personality traits, and having a lack of coping skills. People who care for those who've experienced trauma. People who care for those who've experienced trauma are a group of people who are often overlooked for their risk in developing trauma symptoms. These include people in the helping professions like social workers, therapists, and medical professionals. However, anybody who is chronically exposed to people who are vulnerable and suffering, such as people who've been through trauma, are at risk for developing trauma symptoms themselves. There are a number of ways that we describe the symptoms as they present themselves, and these include vicarious traumatization, secondary traumatization, burnout, and compassion fatigue. If you have any questions or maybe you'd like to share your experience, please leave that for the community. And if you're enjoying this series on trauma, please subscribe to my channel.